You'd be concerned about an infected umbilical cord if the area around the umbilical cord gets red and tender and the baby doesn't want you touching it. Sometimes they do smell a little bit, which is normal, but if it has a really awful rancid smell, you need to call your pediatrician immediately. Absolutely, you can give a sponge bath to a baby, and you can do a quick dip in the water if they get really soiled. But we don't recommend soaking them in a tub until after the umbilical stump has completely fallen off and the area underneath is dry. We try to keep the umbilical stump as dry as possible. Therefore, we don't recommend putting the diaper over the area. Most newborn diapers have a cutout in them so the umbilical stump can be out. But sometimes babies get too big for those newborn diapers, so take the size 1 diaper and just roll it in so that the stump is not rubbing on it. As tempting as it may be, please don't pull off the stump. Nature will take care of itself, and eventually it'll be gone. We recommend cleaning the area around the umbilical stump several times a day. It really depends on how quickly the baby's body is getting rid of the stump. Sometimes 2 or 3 times a day will do the job, but other times it takes with every diaper change. We recommend cleaning the umbilical cord with a damp rag. We don't recommend alcohol or soap and water, so please just use a damp rag. You'll be seen by your pediatrician at 2 weeks old, and at that time, if it hasn't fallen off at that point, occasionally we'll use something called silver nitrate. And definitely, if the stump is still on at 3 weeks, call your pediatrician. We'll want to take a look at it. It's very common for the stump to fall off and leave an area underneath that looks a little ooey and gooey. There may be even a little bit of bleeding around the edge, which is also totally normal. If it has not dried up within a couple of days, or if the bleeding gets to the point that it is not just streaks, call your pediatrician. Often we have to cauterize them with something called silver nitrate. If there's a small amount of bleeding, just wipe it off. It's not unusual to have little streaks on the diaper or the clothing. If it is more than just a small streak, please call your pediatrician immediately. The umbilical cord, when it is first cut, is very moist looking. It will go through phases where it will get drier, and then right at the base, as the body is rejecting the umbilical stump, it often gets wetter again. It should never have copious water coming out of it.